And on the sale of alcohol remains a hot potato for government. It's been almost a month since the President banned alcohol sales for a second time with immediate effect. That was on the 12th of July. While the burden on hospitals has eased, the impact on the economy has been devastating. It seems clear the ban cannot continue indefinitely, but medical experts have asked the Health Minister to lift the ban gradually. Professor Charles Parry of the South African Medical Research Council proposes some short-term conditions. He joins us now via Skype from Cape Town. Good evening, Professor. Thanks so much for your time. Now, the ban on the alcohol sales, it did help the hospitals, didn't it?
Yes, we believe it did. At that time, sort of round about the 13th of July, there was a lot of pressure, particularly in the Eastern Cape and Gauteng, on hospitals, and certainly from data we've seen, there was a certain reduction in the trauma visits, and that not only provided beds, but also gave relief to the hospital staff who have to service those beds.
Where exactly are we with the pandemic? We know that some parts of the country are through the worst of the pandemic. I would imagine that any attempt to discuss a lifting of the ban needs to be timed with what's happening in terms of infections. But we also know that there's some concern that Gauteng is going to spike later next month and that KwaZulu-Natal is still to see the worst.
Certainly, I think we're seeing sort of substantial problems in KwaZulu-Natal at this time, but some parts of the country are certainly seem to be seeing the curve over. But certainly, as you say, we are worried that there might be, a second spike if people don't adhere to the sort of social distancing measures and wearing masks and things like that.
All right, so talk to us about the gradual lifting plan. And it's interesting that it comes from someone such as yourself, because you are absolutely emphatic at how alcohol does impact on hospitals. But for a scientist such as yourself to realize and to see that it cannot continue indefinitely, I think puts you in a very unbiased position. So how could we do this gradually and safely?
Yeah, I think certainly no one sees the ban on sales as a long-term strategy. It's a sort of interim measure, and it's not going to be effective. It'll lead to sort of illegal selling and other problems and jobs as well. So certainly our recommendation is short-term measures. But our problem in South Africa is heavy drinking. We about at least 50% of drinkers engage in binge drinking, and we are the 6th highest in the world in terms of heavy drinking. So that's something we've got to deal with in the medium and long term. We can't continue with the current situation, even apart from a coronavirus epidemic.
Yeah, I mean, I think it's highlighted that we are a nation of binge drinkers, and something, as you say, long term has to be done to fix that. But talk to me about these short term measures. Just give me the sort of practical ideas that you've put on the table for government.
Sure. The short-term measures really are what should be, implemented at the time that the ban on sales is lifted, and they fall into sort of 3 areas. Firstly, around availability. Secondly, around packaging and advertising, and the third area is drink driving, which probably people wouldn't have too many problems with. Regarding availability, I mean, the one point is limiting the quantities that people can purchase. And in fact, that was something put on the table by the industry during level 4 when they were trying to get the sales ban lifted there. I think what we're really aiming for is stopping people buying bucky loads and then reselling it. So sort of reasonable limits, maybe 12 bottles of wine, something like that, and the equivalent in other types of alcohol. And making sure that you also can't transport more than that amount unless you have a valid permit. So going from 0 to at least something. And the second one might be limiting to 3 days per week. Currently it's 0. So maybe 3 is certainly a lot better than 0.
Can I just stop you there and jump in? Let's say, OK, you can buy 12 bottles. What's to stop me buying 12 bottles at this bottle store and then immediately going to another bottle store and buying another 12 bottles?
Well, depending on if there are roadblocks and you're caught with 24 bottles, then you're going to be double the limit. So yes, it's just to make it harder, reduce availability. Obviously, if people want to get around it, they can go in 3 different vehicles and pick up 12 bottles each. But just to make it a little bit more difficult and to make the point that we're in a pandemic and we're trying to reduce availability, but particularly trying to prevent the sort of bucky loads full where it's resold with someone without a license reselling.
Fair enough. The second point, you said packaging and advertising. How could that help?
Yeah, I think at this particular point in time, we shouldn't be promoting alcohol products. Obviously, people need to know that they want to buy this wine versus this other kind of wine. So at the point of sale, whether it's online or at the shop, let people know what they're buying. But take away the sort of lifestyle marketing, which is very pervasive in South Africa, and also specials, sort of buy 4, get 1 free. We're saying during sort of coronavirus level 3, we shouldn't have marketing and specials, so you only have advertising at point of sale. The other points around packaging would be container sizes. We're starting to get more information that larger container sizes is related to heavy drinking. I mean, if you go into a restaurant and you get given a wine glass, which is enormous, you're going to drink more because you're going to think the big glass is just one glass. And the same with the larger containers of beer. So limit the sale of beer to a maximum of 500 ml containers and cider as well, and then spirits and wine to 750. So at this particular time, limit those container sizes.
I see. And then your third point is around driving. And I know that the restaurant industry, just before the ban was reimposed, were suggesting that alcohol be sold, but then the limit, alcohol blood limit, goes down to 0, that you simply cannot have any alcohol in your system if you're driving. Is that your third proposal?
It's actually 0.02. I think one has to be pragmatic. Given that people might have medications in them which have alcohol. So make it 0.02. But I think the big issue is also enforcement. There's no point in just having it on paper. Enforcement, and then when there's a serious motor vehicle collision, to do breath or blood alcohol testing so that information becomes available. We've got to speed that up.
Now, last time, and I remember you mentioning this to me, you recommended a tightening of trading in a similar fashion to what you have just now, and you were surprised when government decided to go for a total ban. So have you any indication whether the Command Council is actually going to listen to your suggestions and will do as you suggest, or is it really up to them?
Well, I think they met today, but I have no idea what they suggest, what they're going to go with. But certainly at the beginning of level 3, I had suggested that we go with a sort of a basket of these sort of lesser measures. And if they don't work, then you say, well, we tried them, then we go with something harsher. But certainly I think the government is looking at these measures. I've sent them through to various arms of government, and they are certainly considering them as a way to implement them during the lockdown regulations. Obviously, many of them would need to go to Parliament if you're going to make these sort of changes long term. But they could, I believe they could be implemented as part of the lockdown regulations, and give people access to alcohol, reasonable amount of alcohol, but also send out the message that heavy drinking is not going to be tolerated. It's putting everybody at risk. It's putting the industry at risk. It's putting our hospitals at risk. And so forth.
It's a very reasonable point that you're making. The question I have for you, and I understand, of course, that ultimately government makes this decision, but coming from your area of expertise, Professor, when would you like to see this gradual lifting begin? How soon could you see it starting?
It's a very difficult one because I think we need to know better what the capacity constraints are around the country. And I don't have a full. I'm going to sort of duck your question in a way because I don't have a full sense of how bad the situation is around the country. But certainly, I think we really need to, if possible, even give people a date so they can plan towards when it's going to be lifted, and also get these measures ready. It can't go on for months. It can only be weeks, I would think. But this is, as I say, not my decision to make.
Yes, of course, and we understand. And thank you very much for sharing the plan with us. We really do appreciate it. Professor Charles Parry of the SA Medical Research Council telling us that they have sent to government a series of proposals on how to open up alcohol sales again safely.